The diagnosis of heart disease was made later in women than in men, and sometimes not even made until they had a catastrophic complication like a massive heart attack or stroke.
By the way, Dr. Agatston, it's interesting to learn, we learned before the show, studied under Dr. Shaw, is that right?
Yeah, his great lectures actually influenced me to go into cardiology.
Oh, wow.
Well, that's a So you're partially responsible for the success of this book, PK.
Well, I hope he shares that with me.
Might not have a big
Just kidding, Arthur.
Patty Duke, what's...
We'll negotiate after the show.
Okay, okay.
Patty Duke, what's your story? What happened?
My story is that for a couple of years I was having some blockages in my arteries, and they were taken care of very well by stents.
Angioplasty.
Yes. And then there came the moment where we'd done enough stents, and it was time to do open heart surgery in order to fix the right coronary artery. And it's funny, you know, you don't know how you're going to react till a doctor tells you that. And I, of course, always want to be real cool. I was real cool with a quivering lip and terrified, utterly terrified. Do you know, right after the surgery, I mean, it hurt. There were things that hurt, but I felt better up here.
Me too.
I really did. You know that feeling?
Oh, I was scared to... Nothing scarier than facing. Are you aware of that, Dr. Shaw?
Oh, absolutely.
That the patient is scared to death?
Absolutely, absolutely. In fact, people have recorded conversations with patients prior to surgery and then after surgery and compared. And there's a big difference in how patients perceived going in as well as coming out. What a big difference. Very scary. Even though they may be very stoic and deny it, but when you really, really question them, it is a scary moment to go under the gun, under the knife.
Jenny, yours has been in the family, right? You don't have heart disease.
No, I don't have heart disease.
Knock on wood.
Yes, please. My father suffered his first heart attack when I was 9 and has been battling heart disease for the last 26 years.
Other heart attacks after that?
Yes, he's actually had, I think, 4 or 5 open heart surgeries and is now in the throes of congestive heart failure as a result of a damaged heart muscle.
How old?
He is 73, but he will not give up. He just keeps rallying. Every time I think that he's going downhill, he comes back stronger than ever because he has such a great will to live.
He's the inspiration for the rest of us.
Mm-hmm. Are you concerned about yourself since you probably have the gene?
Definitely. I mean, I was grilling Dr. Shaw in the green room. He said if you recommended him, by the way, he would be my cardiologist. Should I need one? Okay, good.
Not bad.
Yeah, it's something I definitely think about, and especially since with my work with the American Heart Association and the Go Red for Women campaign, I've really become sort of ultra-sensitive and thinking about going and getting some tests done.
We'll get to it's a good idea. We'll get to all that. Now, Kate, you had, what, a hole in your heart?
I had an ASD, an atrial septal defect, which is a hole in my heart. And
how'd you pick that up? How did they pick it up?
Jerry Pohos, Dr. Gerald Pohos, who's the head of cardiology at SC now, was in Alabama at UAB when my mom lived down there, and I was coming home from doing a television movie, and I just didn't feel very good. And we'd been doing night shooting, so I'd been up all night and trying to sleep in the day. And I got home to visit, and I couldn't sleep in the night, couldn't sleep in the day, and I really felt terrible. And I called him and said, Jerry, I just don't feel good. I think I belong in the hospital. And he arranged for me to have a bed, and they all fussed over me. And he was leaving, walking toward the door. I could see it in my mind. And he said, well, I am a cardiologist. And he turned around and said, I might as well listen to your heart. And he heard it with the stethoscope. And I hadn't been a stranger to doctors, and it had been missed on EKGs and on all sorts of things. So the next day they sent in what's the machine? The ultrasound machine, and I had an MRI, and they did the EKG, and they confirmed his diagnosis that I had an ASD.
How'd they miss it, PK?
Well, this is a hole in the heart that you're born with between the two upper chambers of the heart, and it produces very subtle findings that an experienced cardiologist can listen to and suspect it, but a casual observer, a casual physician may completely miss it. Luckily, it's very easy to confirm the diagnosis with a simple non-invasive echocardiogram, an ultrasound of the heart. And unlike what Kate had, she had a surgical closure of the hole. Nowadays, we don't do surgery for these holes.
What do you do?
We fix them non-surgically using a special catheter that you thread through the groin under local anesthesia. And at the end of the catheter, you deploy an umbrella-like device that you push across the hole and pull back, and it deploys and closes the hole non-surgically. It takes an hour or two, and we do it day in and day out. So you're home the next day, you take aspirin and Plavix for a few months, and you're done.
Dr. Agatston, how rapid are these advances?
Well, they're really accelerating as we speak, and I think one of the important messages is that cardiologists and internists around the country who are practicing aggressive prevention are really not seeing heart attacks in their practices anymore. There are naturally always exceptions, but a lot of the future is now. We know how to prevent heart attacks. Unfortunately, too many of our resources are oriented towards the end of the process after somebody's had a heart attack with bypass surgery and stents, rather than prevention before. And in New York City recently, there was a New York Times story about diabetes prevention clinics. And the prevention clinics were doing so well at preventing the complications of diabetes that there were not enough amputations and heart surgeries to pay for the clinics because they don't pay for the prevention, and clinics had to close. So we have to concentrate more on prevention.
We'll take a break and come right back with more. Our entire program tonight devoted to Go Red, the women campaign of National Wear Red Day to focus alert on women and heart disease. Don't go away.
Please join me and the American Heart Association as we carry a strong message to women across America. Cardiovascular disease is our disease too. Let's do something about it.
Cardiologist, and we started a Larry King Cardiac Foundation. That foundation helps people who can't afford it to get various heart procedures. We have, if you want more information on the foundation, it's lkcf.org. But I wanted to read a letter. You may notice we're all wearing these little red bands. Everyone has one. I got a letter from a young man in Bethesda, Maryland. He's 11 years old. Said, "Dear Mr. King, my name is Matthew Markell, and I'm writing to you on account of a loss. My father had just died recently, so I haven't been feeling so great. But when I heard about your organization, I felt better, because then I knew that I could save somebody else's father and make myself feel better, knowing that I could save a life and spare a family from the pain this whole experience has caused me. I really wanted to help, so I made things like Live Strong bands, but instead of saying Live Strong, it was red and said, Be Smart, Save a Heart. I have had help with my friend Mason Carmel and some other people to help me sell them in school. Thank you for taking time to read my letter." And these are those things. That's the kind of thing that expands it. When you have it hit home to your own. Do you take special care of your dad, Jenny?
Oh, yes.
Check on him every day?
I call pretty much every day. My mom's with him every day, and he's just such an amazing man. I love spending time with him. I love my two daughters. To be able to spend every day with him is just so valued and cherished.
Patty, do you do good post-operative? Are you taking care of yourself?
Yes, I did my rehab, although I tried to find every way out of it. But I did go and do my rehab, and now I do walking, and I eat in a far more healthy fashion.
Do you have to watch yourself, Kate?
Oh, sure. Well, I was lucky. I've always sort of lived a heart-healthy lifestyle, which is sort of what we were talking about a minute ago. We're concentrating on what happens after heart disease has been diagnosed, and what do you do to keep it from happening, because it is a lifestyle choice, pretty much. You choose what you eat, you choose whether or not you exercise, and you choose whether or not you smoke, which is probably the one single most devastating thing you can do to your health anyway. But if you choose to eat a heart-healthy diet, and it's easy to find out what that is, you can go to the American Heart Association's website, many other places. If you choose to exercise half an hour a day, and if you choose not to smoke, you will not choose to have heart disease. If you don't, if you make the other choices and you eat lots of fat and you get your cholesterol all up, and you live a sedentary lifestyle, and you smoke, then you choose heart disease. So if we can, like on this show, if we can maybe help a few people who are watching not choose heart disease, we will have done an awful lot.
What, Dr. Shaw, and the same one for Dr. Agatston, what about this whole disease process, you work with it every day, puzzles you the most?
Well,
what about heart disease knocks your mind out?
Completely agree with Kate. It's largely a lifestyle issue, but not entirely. There are genetic predispositions for some individuals that they look at a cigarette, let alone smoking, and they drop dead of a heart attack. And there are others, like Winston Churchill, who smoke, who are fat, who have high cholesterol, they live to be 90. What's different is the genetic makeup. But genes basically load the gun, lifestyle pulls the trigger.
Can you ever change the gene?
You can abort the consequences of a genetic predisposition by adopting a healthy lifestyle. You can suppress it.
But what Dr. Agatston, bugs you about the disease itself? What is it about the disease that confounds you?
Well, really, the way it's often forgotten, and we don't appreciate how treatable it is. And when you read a story like of that 11-year-old who lost his dad, and I feel that that's completely preventable. And we have to realize that for somebody who's heading for a heart attack in their 50s, 60s, 70s, there's arteriosclerosis building up in your teenage, young adult years. 25% of Vietnam casualties already had arteriosclerosis in their artery walls. So it's a long process, and it gives us a long time to intervene. And we have to know our risk factors, and if we have risk factors, then we have to really be careful about diet and lifestyle, and about early diagnosis. Do regular blood tests. There are imaging studies today where you can see the buildup of plaque in the arteries years before it causes a heart attack or stroke. So early detection and early treatment is key.
I take 11 different drugs a day. How many do you take?
I don't take any heart medicine.
No?
None.
Your father, how many does he take?
I couldn't count the amount of medicine that he takes on a daily basis.
How much do you take, Kate?
2 baby aspirin.
That's all?
Mm-hmm. Well, I mean, I take my vitamins, and I get a lot of medicine through my food.
Are there wonder drugs in this field?
Well, there are wonder drugs that we have currently available, and for reducing the risk of a heart attack or a stroke, among the medications, aspirin is effective. Cholesterol-lowering medications like the statins are effective in the vast majority of cases. But coming down the pike are new classes of medications that will allow us to actually reverse plaque that's already there. And these medications are based on boosting the function or the levels of the good cholesterol in the body, which is the HDL cholesterol. One of these drugs we developed in our laboratory at Cedars-Sinai is an injectable HDL that once the clinical trials are completed, and if they confirm what we saw in our animal tests, it's shrinking plaque, we will have in the next 3 to 4 years drugs like that and many others that work similarly to reverse plaque buildup. So I think the future actually looks very good for atherosclerosis.
We'll take a hold. Let me get a break, Kate. We'll pick up on that. That's extraordinary. Don't go away. We'll be right back.
Wait a minute, how long?
You know, some of this is genetic, and I may have done some damage in those years when I was too careless about what I ate. So for whatever reason, I've got a problem, and I've got a chance to deal with it, and I feel that I really got to, let me just say this, Republicans aren't the only people that want 4 more years here.